In the meantime, less than 1% of Nigeria's population has received the COVID-19 vaccine. The government had announced that frontline health workers, government officials, and people with pre-existing conditions would be prioritized in the vaccination rollout. But how much of that population have been fully covered? Mr. Augustine Ajijelek is a pharmacist. He joins us for more on this from our Abuja studios. Thank you for joining us on the program. First, what's your take on the delay Nigeria is experiencing in vaccinating its population? And do you think there's a way we can get out of this?
Yes, thank you for having me, Millicent. As it stands right now, we have not vaccinated significantly, even among those whom we have deemed to be eligible for testing, for vaccination. And there are a number of reasons. First of all, the interruption of the supply of vaccines, and this is due to some issues that have been happening globally. And also, additionally, because we have not dealt with the pharmaceutical companies that are producing these vaccines directly. Rather, we have relied largely on multilateral arrangements, which sometimes are a bit cumbersome and slow down the system. So there's a way out of it in the sense that we may need to complement existing efforts with direct purchases of these vaccines from the manufacturing companies to help complement the efforts that we are doing currently.
How would you assess the rollout of the process, the National Primary Healthcare Development Agency? We know that the second dose is being administered, but there are still vaccine skeptics. What would you say is responsible for that?
Okay, the National Primary Healthcare Development Agency has done relatively okay if you consider the resource limitation with which they have had to work. Possibly with more resources, we would like to see a much more robust information sharing mechanism. We would like to also see more vaccination centers. And then we would like to also have the online registration platforms functioning much more seamlessly in the sense that because we have experienced a lot of frustrations with people trying to register and then failing to register. So the resource limitation has been there. Hopefully we can get much more resources at their disposal so that they can do the needful, especially in terms of information dissemination, because we know that getting information from the wrong sources and example, social media, beer parlor gossip, and the rest of them have not helped knowledge on COVID-19 and also has affected acceptance of these vaccines.
So if we look at the weapons to fighting COVID-19, the non-pharmaceutical interventions, the testing, contact tracing, vaccination, if we aren't doing much of that list, and if the country is not yet out of the woods, and I mean, how do we continue to keep citizens safe and aware that there is still a pandemic the world is fighting?
Yes, looking at what has the experience of other countries, especially India, the severe disruptions they have suffered, in spite of how developed their supply chain is in terms of healthcare, because we even rely on them largely for a lot of commodities to provide healthcare in Nigeria. But we saw that initially we thought they were very comfortable, and then a mutation happened and the variant came that was much more infective and even much more severe in terms of the effects it caused. So we need to not let down our guard. What we need to do is to intensify all these measures, ensure that all the mitigation measures are revamped and maintained. Then we should ensure that we provide much more information through qualified people and not allow people to be getting information from sources that are not actually verified or not even scientific. Additionally, we need to also intensify action on getting the vaccines. We have switched to Johnson & Johnson, so we need to get it in the country and then begin the vaccination quickly. And then we need to give out this message very loudly that those who have started the vaccination need to follow up and ensure that they complete their second dose. And those who are yet to get that vaccine should register and be ready to get the vaccine anytime it becomes available.
We always appreciate your time on the program. Thank you, Mr. Augustine Ajijelek, a pharmacist. Thank you for joining us on the program.
Thank you very much. It's my pleasure.